So it's actually good that Shelley went through the dashboard, and I really appreciate the state putting in the additional data for flu and RSV. I think that's really helpful, and I think that's going to be more and more helpful as this year draws along into winter, and I think we will unfortunately see the convergence of COVID-19 and flu and some of the other respiratory diseases that we generally deal with during the winter months. So I think that things are unfortunately lining up the way many of us have feared they would. And I think it's helpful to kind of take a step back and look at where we are in this season. So these are the data most recently from the United States. And again, I think that the folks who are celebrating the end of the pandemic, as many called it, with the Delta wave receding, were obviously premature. You can see that for the US over the last 2 weeks, we've actually been at a steady plateau, and in fact have even begun to grow a little bit in terms of our overall case count. And you can see that our overall national vaccination rate is 58% fully vaccinated, which is well behind other countries. That most other industrialized countries have actually passed us. And again, like Portugal, whose vaccination rate is well into the 80s, those countries are faring much better. And we've talked about the UK and the fact that even with very high case counts, they've still had a relatively low rate of hospitalization. That's significant decoupling of case and hospitalization curves, and we'll talk a little more about that here. So this is the national picture. Again, can be misleading because that's really a aggregation of multiple local and regional epidemic curves. You can see here that not only have our cases kind of plateaued, our hospitalizations have stopped dropping precipitously and are now hitting a plateau. And even you can start to see the move there in deaths. We are unfortunately well past 750,000 total COVID-19 deaths for the pandemic, an astronomical number when you think about it. And we are, over 1,200 deaths a day. So we're continuing to add to that count. And unfortunately, I think that number is going to go back up. Another concerning trend is that we've been following. You can see the South is still dropping in terms of their total case count, and that's been true for the last couple of months. But we're now seeing growth in the other 4 major quadrants of the country, including ours in the Midwest. In fact, ours is growing more and at a higher rate than the other regions, the Northeast and the West. And so we're really kind of in the middle of a resurgence here. From the heat map, you can see counties in the US that are experiencing the most significant disease activity are concentrated in the Great Plains states and then the upper Midwest and into the Rocky Mountain states. So activity centered, kind of in a crescent from Michigan and the Great Lakes through Minnesota, North Dakota, Montana, and then down into Colorado, New Mexico, and definitely involving our region, South Dakota, Nebraska, Kansas. That's where disease activity has really been centered in the last week or two. And if you remember, this very much replicates what we experienced last year in terms of the geographic pattern. And you're also now starting to see significant activity increasing in the Northeast and New England states and into Pennsylvania, and still a bit in West Virginia and Ohio. So that pattern looks very familiar. We're a couple of weeks ahead of where we were last year, but overall the movement from south, north, and then into the Midwest and Northeast region, again, very similar. If you look at the states that have the highest 14-day increase in cases, you can see that Nebraska of all states ranks 7th. So we've had a 37% increase in our total cases over the last 14 days. And that, again, puts us well within the top 10 of states with accelerating cases. And you can see that in that group of top 10 states, we have the lowest vaccination rate of any. So we are probably going to fare worse, and certainly will fare worse in terms of hospitalizations. Now, I think it's helpful to look at a couple of examples where states having significant spikes are having different experiences. And I know people have liked to point out places like Vermont, which have a very high vaccination rate, and say, well, the vaccine isn't working because they're seeing a significant surge in cases. Well, yes and no, and this reinforces a lot of what we learned about the vaccines over the last 6 months. So first of all, Vermont has a very high vaccination rate relative to the US. 72% of the population of Vermont is fully vaccinated. Again, that's well below where Portugal and some others are, but still for the US, a very high rate, actually the highest in the country. And you can see that Vermont still has had a significant rise in case counts compared to where they were previously. So the most recent data, their 7-day average is 315 cases per day compared to the peak that they had back in January, which was 173 cases. They had this other peak in April with the Alpha variant, but they had lower hospitalizations and already had vaccines. So we'll kind of compare the winter wave, which was their most severe, to the wave going on right now. And so you can see that they are at about 182% of their previous winter peak. Now, this is a huge spike for the state of Vermont, and it is by far the worst they've seen in terms of case numbers. I think helpful to point out that there's still only about 45 cases per 100,000 per day, which is well below where other states with low vaccination rates have peaked. Many up in the 90 to 100 range or even higher. So relatively speaking, again, what's bad in Vermont is not necessarily bad in other states. But what you can see is Vermont's hospitalization peak still has not achieved what they did back in the winter wave. And so their current peak hospitalizations compared to the peak back in January when they had their winter wave is 83%. So that delta, the difference between the growth in case curves relative to winter and growth in hospitalization curve relative to winter is negative 99 percentage points. So again, they're at a significantly disproportionately low hospitalization rate compared to their case count. And this replicates what we saw and what we've seen in many other countries, but including what I pointed out in the UK, that their decoupling of hospitalizations and case counts is pretty significant. And so we're seeing this in Vermont again because of the high vaccination rate. The other thing to look at on the right, these are hospitalization rates per 100,000 by age group. And you can see that their hospitalization rate among their younger populations, particularly look at the 30 to 49-year-old and 50 to 59-year-old, relatively similar to where they were in their previous peak. So they haven't seen a significant growth there, and their hospitalization rate among 70-year-old plus, 60 plus, and then 70 plus, relatively similar to what they've seen before. I think this does indicate that certainly in the 65 and older and 70 and older group, we are starting to see waning in protection. But again, proportionally speaking, compared to where their hospitalization or their case rates were in the winter, they're still performing better. Now let's look at West Virginia, which is another state that's recently experienced a high spike, and as you can see, is dramatically different in terms of their vaccination rate. They only have 41% of their population fully vaccinated compared to the 73%, I think it was, in Vermont. And so you can see West Virginia also has had a significant spike in cases recently with the Delta wave, and you can see about 128% of their winter case peak. So they're like Vermont, significantly above where they were back in the winter. But what you can see here is their hospitalization rate is actually higher. And so it's relatively similar. It's about the same, right? They've had 121% peak of hospitalizations compared to their previous winter peak and 128% cases. So Instead of the negative 99 percentage point delta, they only have a negative 7 delta. And so it's relatively similar. They do not have this decoupling as we see in Vermont and as we saw in the UK. And the thing to notice here is the burden of hospitalization is disproportionately affecting younger populations. You can see that their hospitalization rate for 70 plus is slightly lower than it was in their previous peak. Their hospitalization rate for 60 to 69 is slightly higher, but only ever so slightly. But then everybody else, 50 to 59, 30 to 49, 18 to 29, all of those are considerably higher than where they were. Even the under 18 pediatric population, you can see that light colored curve at the very bottom. Back in the winter, it was hugging zero, right? Barely detectable above the zero line. And back in September and into October, it was significantly higher. And so that reflects the different demographics of vaccination. In most states, including West Virginia, vaccination rates among 70 plus is quite high, even above the age of 60. But vaccination rates in younger adults, really, and everybody over the age of 12 to age 60, in states like West Virginia is dramatically lower than what it is in Vermont. And that's where we're seeing the biggest difference in hospitalization. Now, you can look at several states together. I chose 3 of the highest vaccination rates for states versus 3 of the lowest vaccination rates for states. And you can see for cases, the lowest vaccination rate states had significantly higher case counts in terms of cases per 100,000 per day. You can see that most of them exceeded 80 per 100,000 per day, where Vermont, again, is tapped out around 45 at their peak. But about twice as many, maybe 2.5 times as many cases in those low vaccination states. And I would argue that the difference may be a little higher because case ascertainment in those states is probably a bit lower than it is in the higher vaccination rate states where testing is more prevalent. But when you look at the difference in deaths, the difference in deaths is profound, right? So that difference in deaths for those states is significantly more for these states with low vaccination rates. You can see the rate of deaths is 3 times or more compared to for West Virginia, Wyoming, and Idaho, compared to the peak in deaths that we've seen in Vermont, Rhode Island, and New Hampshire for the Delta wave. And again, this shows the effectiveness of vaccines in the real world, where these states with high vaccination rates are faring considerably better in terms of fatalities. Now, where are we? You can see here that we've had now essentially 2 months of plateaued case counts. We really haven't moved very much. And if anything, as we pointed out over the last 2 weeks, we've seen a significant increase in our case counts. And again, our state vaccination rate is 57%. We talk about 68% being that percentage of eligible, but the virus really doesn't care whether you're eligible or not, and the virus doesn't care about our attempts to spin numbers. It only cares about how many people are fully vaccinated and immune to the virus. And so what the virus sees is 57% of our population has good protection against infection and hospitalization and death, and that's the number we should really focus on. And it's not high enough by far. You can see that we've actually had a pretty good difference in peak hospitalization compared to where we were before. I think that is a little bit skewed because while we have this steady plateau, we're actually accumulating an area under the curve, which is the total number of hospitalizations that is probably starting to approach what we experienced with our winter wave, and will probably meet or exceed that eventually in terms of COVID hospitalizations. We're just drawing out that number over a larger period of time, which is good. It means less of an acute strain on the hospital system at any given time. But obviously, as we've discussed, we have less capacity free now than we've had previously. The other thing to note is that we've had a significant increase in hospitalizations, in the younger populations. We've done much better in terms of our hospitalizations rates for 70 plus. I think some of that represents the very good work that Dr. Ashraf and others have done with long-term care facilities. But you can see that our numbers for younger folks similar to West Virginia are higher. And now the really frightening part about what's starting to happen here is flu season is now starting to rear its ugly head. So these are the numbers now for 2021 flu season. We're in week 43 right now with the latest data that we have. Shelley pointed out some of the data coming from our state indicating that we're having more influenza detected than we certainly did last year. What you can see is right now for week 43 nationwide, we had 23 confirmed, laboratory confirmed cases of influenza. All of these are H3N2, and H3N2 generally are more severe influenza seasons with higher death tolls than our H1 dominant years recently. We'll see how that pans out. But if you compare that to where we were last year, you can see that last year in week 43, nationwide, we had 2 confirmed cases of influenza in that 5 to 24-year-old age group. Sorry, and I should point out that I'm focusing specifically on the 5 to 24-year-old age group because that is generally the herald group for influenza season in a community. Flu usually starts spreading in school-age children and young adults first, and then kind of makes its way into the rest of the community. So again, in that 5 to 24-year-old group, we've seen 23 cases nationwide in week 43 this year, compared to 2 cases in week 43 last year. And if you look at a relatively standard influenza season, which was the year before COVID-19 hit, the 2019-2020 season, you can see that we had around 55 cases week 43 for when we were experiencing a normal influenza season. So we're a lot closer to that influenza season than we certainly were last year. Actually, I think that 55 is just for flu B. I think the total count is around 100. But as you can see, for the 5 to 24-year-old, we're certainly much closer to a standard influenza season as we've seen 2 years ago compared to where we are now. If you look at the rates of influenza-like illness occurring this year, you can see that our ILI rate is actually at baseline well above where we generally start. With other influenza seasons, some of that is probably the overlap between COVID cases and ILI, but you can see that we're on the rise now over the last couple of weeks compared to where we have been. And I think that these curves will continue to, this current season's curve will continue to track along with what we would experience as a normal influenza season. If you look down at the bottom there, that's last year's 2020-2021 season, which essentially was pretty much an undulating flat line for the entire year because we basically didn't have a flu season. Unfortunately, I don't think that's going to be the case this year. And then the last thing to leave us with is, even in the absence of flu in 2020 and 2021, this was the excess mortality graphic for pneumonia, influenza, and COVID mortality over the span of this pandemic. So again, just reinforcing for folks who think that somehow COVID-19 is no worse than the flu, that band of parallel sinusoidal lines is where we expect influenza and pneumonia mortality to reside. You can see in 2018, we had a pretty bad flu season, so we spiked above that, but nothing near what we've seen here over the last year and a half. So that's where we are, and unfortunately, again, I think we're seeing early signs that flu season is coming. And again, I just had the crawler go across my desktop here saying that our hospital's full. I think lots of other hospitals are full as well. Not sure where we're going to put all of these additional COVID patients that it looks like we're going to see, and certainly the large number of influenza patients I think we can expect over the next several months.